Yeah, so this is the thing. I always joke, but I was a so-called COVID early adopter. I actually contracted COVID-19 before vaccines were widely available in September of 2020. So before even Delta, it's a long time ago. But I'm saying even then, I was one of a rare few. You went around and you spoke to people. And like I said, they knew somebody who had contracted COVID. Whereas I was saying to a couple of friends the other day, in the last month or so, or maybe even a bit more, there was about a 2-week stretch, in particular in Montreal, where more people had contracted COVID that I knew directly in that 2-week period than the entire 20-month period sort of preceding that. And that's been the experience of most people. And I think once you start to, it demystifies it, so to speak. You know what I mean? Before it was this big, scary virus. Your only real exposure to it is, some things that you might see on social media or in the news of people hooked up to ICU beds. And then all of a sudden, when your mom and dad, brother and sister, best buddies, cousins get it. And, some of them get a little bit more sick than others, but by and large, it's sort of a run of the mill flu type experience for most people. And, everybody's gone out and sort of, for the most part, done their duty on guillemets and got vaccinated to 80, 85, 90% in different parts of the country. You're saying, hey, why are we still doing this? It doesn't have that same level of, the fear doesn't work as well as it might have otherwise did at earlier parts in the pandemic.
Yeah. And so Rowan, do you think, this would probably be especially true for the vaccinated where their symptoms, if they are infected, are considerably more mild than, let's say, prior to the rollout of vaccines. Do you think that that's playing a role in this frustration in that Angus Reid poll, and where most people are now saying, okay, well, I know what COVID looks like firsthand, and I'm comfortable living with this?
I think so. Just to piggyback on a lot of what Anthony was saying. The same Angus Reid poll was actually saying that since December the 1st, that now 20% of Canadian households have now reported COVID exposure. So it's not some foreign boogeyman. It's something that's actually arrived right on our doorstep. And I think really having the personal experience, a lot of people have not really been severely impacted. I'm not trying to downplay that there obviously were some people that had very adverse results, but I think also it ties into the fact that there are people that legitimately do have to be concerned with COVID. Whereas, you might look at a younger person, perhaps lacking the comorbidities, where they're just really feeling that the cure is worse than the disease. For example, just very, very quickly, just to add on, in Ontario, it's now our reopening day. But what we've now had to endure is we've had an extended period of, say, a lot of relatively younger and healthy people, for example, have not been able to go to the gym. So I think a lot of people, there's a disconnect. Like they're saying, well, are we really being harmed more than what we're being helped by these various measures, and are they even effective at all?
Yeah, it's a very good point. I was one of those Canadians or those Ontarians who exercised my newfound freedom to go to the gym. It was certainly appreciated. Do you guys feel, we have about a minute and a half left, do you guys feel that this is the start of something bigger? And I ask that in the context of other convoys that have been announced. I'm not sure if they'll come to fruition in Europe, in the UK. Is this the beginning of a movement or a moment in countries like Canada, the United States, throughout Europe, where maybe this is the tipping point?
Well, I'm going to say this, and this is a partially aspirational statement, I guess, on some level. But I think we've reached the end of this thing, or at the very least, we've reached the beginning of the end. And you're starting to see that. The United Kingdom says, we're done. Ireland saying, we're done. Countries like the Netherlands and Denmark and all across Europe are saying, we're done. Large swaths of the United States have done the same for quite some time, but now in increasing number. So I think moving into this summer, there's a lot of cause for optimism. The polling has switched. The evidence is here. People have gotten their vaccinations. Hospitalizations and ICU admissions are down. The virus is evolving in a way such that it is less lethal. So I'm saying, I think we're reaching that critical mass point where, all right, guys, time to get on with our lives.